Good afternoon, everyone. Okay, so thank you, everyone, for joining us this afternoon. It's going to be a really interesting discussion. We're really lucky to have such fantastic panelists here, and really interested to hear both what everyone's going to say and see how the discussion goes a little bit afterwards. So just to introduce the people who are going to be talking, we have Lord Clement Jones, who's a Liberal Democrat peer, and is the spokesperson for digital and the co-chair of the Artificial Intelligence All-Party Parliamentary Group. So I think some of the people in the audience probably will have joined that group and seen some of that work. We're joined by Alison Roche, who's a policy officer with Unison, who we've worked with quite a bit over the recent months at Futurecare Capital. Sue Daly, the Associate Director of Technology and Innovation at Tech UK, and Tech UK is very much a household name, I think, these days. So really excited to have you here. And then last but by no means least, Ruth Bergen, who's a Senior Advisor at the Trade Justice Movement, who's been doing quite a lot of work with particularly Anne-Marie at Futurecare Capital. And yeah, we're really interested to see where this discussion is going to go. In terms of areas that Futurecare Capital are most interested in, I should probably actually do the introduction to Futurecare Capital. I'm really sorry, everyone. I'll just so I know that a lot of people who have registered have been to Futurecare Capital events before. But for those that are joining for the first time, Futurecare Capital is a charity, first and foremost, and we have a 70-year history, and the Queen is our patron. Our vision is to see all those people in the UK in the receipt of care or healthcare benefit from a functioning, fit-for-purpose health and care system. And we operate in three main areas. We work with policymakers through our proprietary research, and that's part of our way of making sure that our beneficiaries' voices are heard and the policy is being made in line with their best interests. We also work with and support health and care practitioners, bring together Futurecare Capital's and others' research. So that can be through defined individual projects and initiatives. But then we're also very interested in sparking new debates and seeing where we can develop new areas. And hopefully very soon there's a few announcements that we're going to be able to make in terms of different areas that we're going to be pursuing going forward. And then more recently, we've also started looking into how we can invest and partner for social impact and really make sure that we're not just putting out ideas and talking about topics, but we're committing to them and really developing them from the ground up. So yeah, that's where we are. And if you're interested in working with us, please do send us an email or tweet at us or get in touch in any way through all of the channels that are at the bottom of this slide. In terms of trade and the idea of global Britain, this sort of means a lot of things to different people, and I think everyone will probably be fairly aware of the various skepticism and different ways that people talk about global Britain. But we're really looking at what trade means going forwards, particularly for health and social care, and how that impacts digital healthcare, data, technology, and innovation efforts. And everyone on the panel is really well versed in these areas, and I'm really excited to hear both their individual descriptions of the topic, but then also the answers to some of the questions. So as time goes by, if you in the audience do have questions, please do pop them in the chat, and we'll get to them in the Q&A towards the end. So if we go to Lord Clement Jones first, and then we'll take it from there. So Tim, over to you.
Well, Thank you very much. I absolutely share FCC's concerns. I mean, I'm an enthusiast for the adoption of new technology, but even when a body such as AXREM, who represent quite a number of health tech companies, said one of the real barriers to the broad adoption of AI is problematic because early healthcare AI projects have failed to manage patient data effectively, then I think that's a cause for concern. And there's real concern when you add to the fact that you look at some of the not just stories, they're events. The Department of Health selling medical data to US and other pharma companies on the basis that this information would be anonymous or anonymized, and it wasn't. And then you get the Amazon deal, which was reported back in late 2019. And then, of course, we've got the whole issue of Foxglove, which has now issued a lawsuit against the NHS over the contract with Palantir Technologies. So, there's a concern out there. And then you see a pretty unadorned government priority. They've got 10 new technology priorities, one of which is championing free and fair digital trade. Well, that sounds all very well. But we will ensure our trade deals include cutting edge digital provisions, as we did with Japan, and forge new digital partnerships, and so on. And the question then arises, and we had, of course, debates, which I'll come to very quickly, on the trade bill. But what guarantee do we have that our health data will be used in a proper fashion, assigned its true value, and used for the benefit of UK healthcare? And, we raised some of these issues back in our House of Lords AI report about the data held by the NHS. We said it was a unique source of value for the nation, and we recommended a framework that would deal with that. Well, we got a pretty bland response, as it happens, from the government. But then we'd had a torrent of documents. We had the data ethics framework in June 2018. We had a guide to good practice for digital and data-driven healthcare technologies that September. Then in July 2019, the guidance creating the right framework to realize the benefits for patients and the NHS, where data underpins innovation, with lots of fine principles. But the big question is, what's the oversight? What's the guarantee of compliance? And then, of course, finally, we had the document from the Centre for Data Ethics and Innovation talking about addressing trust in public sector data use, which really gave the game away. They said efforts to address the issue of public trust directly will only have limited success if they rely on the well-trodden path of developing high-level governance. Well, i.e., if you just have, fine-sounding principles without any compliance mechanism, then this is not going to create public trust. So the key question is really what's happening in practice. And I'm afraid that my experience of arguing with government on this, as Peter well knows, having briefed us extremely effectively during the passage of the trade bill and the medicines bill, has not been very reassuring. We looked at the Japan-UK trade agreement, and the government talked about removing unjustified barriers. But there was nothing really that reassured us that government were going to be using it for public benefit and, in a sense, reinserting the benefit of that back into the NHS. And the same was true on the medicines bill. And I can give chapter and verse, of course, as to what the ministers did say. One thing did happen. Provisions were put in place to ensure consent if patient information is to be disclosed, but we don't have adequate provisions regarding the exploitation internationally of health data. EY estimated this could be worth around 10 billion a year in terms of the benefit delivered. Now, I thought one of the best ideas that came out in the course of the trade bill came from Futurecare Capital. They talked about about establishing a sovereign health fund, and I thought that was a bullseye, actually. We're promised now a health and care data strategy. I think that should be part of it, but we haven't had it yet. We've got a review coming. We've got a national data strategy, which I suppose is meant to encompass a health data strategy. But we've had very little promise of transparency around the use of NHS data, especially in terms of those contracts with the major big tech companies that we're talking about. So there is a kind of ideological championing of the free flow of data, which I think is a bit worrying. We've now got statements from John Whittingdale, who's taken over, I think, the sort of advocacy on this data front. He's talked about the UK's new bold approach to international data transfers. Our international strategy will also explore ways in which we can use data as a strategic asset in the global arena. Sounds extremely fine. But I could go through some of the precise points that I think we need to have, but I won't, because I'm sure that Peter wants to open up the debate. But as a bottom line, we need greater transparency, public accountability. Some of the Ada Lovelace Foundations of Fairness report, I think, has been very usefully added to the debate in terms of how the public should be consulted over the use of NHS data. So a lot of issues arising from this. I think we've got to keep this debate going, because, it isn't just a simple matter of, data is far too important just simply to be treated as a kind of commodity to be dealt with internationally.
Absolutely. Thank you, Tim. That was a really good overview of that whole trade bill process. And thank you very much for your kind words about FCC's work. That was very nice of you.
Well,
you didn't have to. Oh, thank you. If we go next to Alison, I think there's a lot that you can pick up from Tim there, and yeah, let's continue the debate.
Okay, thank you, Peter. And yes, I agree with absolutely everything that Jim has said, and I'm really pleased that it's heartening to know that peers have taken this on board, because we are still trying to raise this on lots of people's radars and agenda. I'm just going to talk largely more from the perspective of the impact of what's happening in trade deals and WTO e-commerce discussions, actually, and how I think that will filter through to the NHS. First of all, just looking at our health and care system, but I'm going to focus mainly on health. When we look at the use of data, AI, ADM, automated decision making, it's clearly not irreversible. It's here for good. There's already been big inroads into that. And as Jim says, there's just very little governance or regulation on it. And I was trying to think of how you could explain that to people. And the first thing I thought was, well, there's a creation of what I'd call a big data infrastructure going on. That's your COVID store, which Palantir's running, if you like. But that data infrastructure, I'm sure, is the first ever infrastructure we've had in the history of the NHS. I could be wrong, but that's what I do understand. The second thing is that we do have then data accumulation into data sets being trained to produce outcomes. So that's your information going into your personal records, whether it's your GP, whether it's in your hospital appointments. It could be actually even used for ambulance times, etc. So you've got the accumulation of data and all those sort of things. Then you've got the increased use of artificial intelligence in medical devices. So, for example, in pacemakers or radiography, robots as well are also being thrown into this. So Siemens are talking about their development of local tools, I've noticed. Then we've got the growth in what I would call platforms, which are private and public at the moment. So the Test and Trace is a platform which has been used by private companies as much as the Test and Trace owned by public health at the moment. And then we've got data being used for life sciences vaccination purposes, and trialing, obviously, for diseases, etc., research. So that's huge, that area. That's absolutely huge. But it is almost, if you go 1 degree or 2 or 3 degrees in the health and social care sector, there's digital there. I think that's our first message that we have to explain to people. And this means that data is driving all this, and the desire to control and own and manipulate that data is really important. Then I'd just like to ask a question. Given we've got this growth in data, it hasn't just come without complications or challenges. It's actually got huge, huge challenges. Firstly, it's moving quicker than the law and quicker than regulations. And as Jim said, it's really complicated trying to understand how the government is regulating. It seems quite fragmented. You have ethics over here, you have innovation over here, you have the ICO here. It's a very fragmented way of organising information so that people understand the impact. So I find it quite confusing sometimes. And also the problem is you don't find out that something's happened until after it's been published. Then we've got, really, in reality, a monopoly or oligopoly, whatever you want to call it, of the big tech companies running and dominating lots of this. Then it's complex. Any new governance is not just going to be on GDPR or new laws. We're looking at competition law, privacy law, equality law, public sector equality duty, data impact assessments. We're looking at how you can increase privacy on all the data flowing. And then we're looking at how are we going to sanction or enforce these breaches that are likely to arise. We've got the cybersecurity needed. We've got prevention of being hacked. It's huge. And then we've also got the fact that you have lots of these companies who really don't want any responsibility to disclose their trade secrets. Their algorithm are protected by copyright or intellectual property laws. And so the burden of proof where you want to say you're liable, or you've just breached health and safety, or I think you've just committed an illegal discrimination act, is on us as civil society, because the law is not backing us at the moment. So all of that has to be changed. So it does beg the question, which I think Jim left us on, if we've got all these challenges, why are we allowing all the governance and rules to be sitting in a trade deal, in an e-commerce chapter? It really is unbelievable if you think about it. So the simple question is that historically, when you had the growth of tech companies, they were governed by telecommunication legislation, but they really didn't quite fit into that regulation. So my understanding is that they were left largely to be unregulated for years. And people didn't really think that they were going to grow into this dominant, actually one of the biggest issues we're going to face in the next 20 years of how we manage all this. So we do have to have that domestic legislation. But the problem we've got is because these big tech companies have been used to having no regulation, they're quite happy for it to sit in a trade deal. They're complicit in it. Trade deals are secret. There's no text published. You can't see what's happening in negotiations. And they are, I'm sorry to say, commercially biased. There's an imbalance between consumer rights, civil society rights in these trade deals. So they're the perfect place for e-commerce to develop without being regulated. And also, it's easy then because Parliament doesn't have to be consulted in WTO. Civil society, trade unions don't have a voice. So there seems to be complicit with big tech companies that they're happy to continue down this road. And that's what we have to push back on to say it is really not acceptable. And then I just wanted to say, if we've got all that happening, what are they trying to do? Let's just be simple. What are they trying to get away with by sticking it in a trade deal? There's lots they're trying to get away with, and I can't list them all here, but really, they want to control and own data and then flow it as freely as possible with as little restrictions. They don't want to have local presence because they don't want to pay tax. They're avoiding digital taxes and tax services, advertising, everything they can do with tax is complete avoidance. I'm not saying it's illegal, I'm just saying they're avoiding it. Then we've got the idea that they don't want to transfer this technology. And if we're looking at global Britain and our duty and responsibility to help developing countries, we would want to have some technology transfer, given that this is going to be one of the largest drivers of production and GDP in the next 20 years. Why would we want to not have some obligation on these big companies making lots of money to not transfer or not use local servers, local computer facilities to provide at least jobs for those people in the country? And then we've got this whole thing going on where they don't feel they have to disclose any of these trade secrets or.
Listen, I think we might move on to Sue and then come back to some of these things in the discussion for the sake of time. No, really, really fascinating ideas there, and definitely going to come back to some of those soon.
No problem.
So Sue, take it away. Love to hear what your perspectives are.
Well, hi everybody. My name is Sue Daly. I'm Director of Technology and Innovation at Tech UK, and it's a real pleasure to be here today. I feel I need to caveat my opening statements by going, I'm not an expert on trade agreements and the WTO work. So, but I'm really keen to be part of this discussion. And already the introductory remarks have raised a lot of issues. There's a lot there to unpack, right? There's a lot of different issues there, which I think some of them are very relevant to the UK and what we may need to be thinking about in terms of future use of data, future use of digital technologies. And to go back to one of Tim's really key points is around how we get public trust and confidence in how we're using data and digital technologies going forward, because and I'm sure that will keep coming up time and time again in our discussion, is key. Also, I think looking at, the legislation, the regulation that we do have in place, and that has been in place for a very long time. I would always say I'm not here to say there's no need for new regulation or legislation, but what is the gap? What doesn't exist right now? What do we need to address? But thinking about the title of Global Britain and the implications for health and care, which was the title, I think, Peter, that we were given to kind of explore. I'm going to be quite cheeky and say implications, but also opportunities. I think it's also important that we think about, what are the, as we move towards this more global Britain role, what are the opportunities ahead of us to really perhaps not only drive forward the innovations, the evolution, the power of digital technologies in health and social care, but also to support what we have is already a world-leading industry in this area that is looking to grow and looking to thrive. But I think what I think is key for us is how do we get that right? Life sciences, health tech is a key market and industry to the UK, and we need to be looking globally at what are the opportunities to grow that market. But how can the UK be a pioneer in how you do that in a responsible, ethical way that means data protection, data privacy rights are held to the highest level? It's about being a pioneer in how you can do this, as well as how you can, in my mind, encourage and stimulate innovation. Trust and confidence has got to go hand in hand with that. But government's plan is for the UK, it's very much to be a pioneer of future science and tech superpower. And how do we do that? And I think developing greater international cooperation, collaboration, and trade agreements and other tools help us enable us to do that. Trade agreements also enable us to bring people together to talk about, how we get some of the rules of the road right. How do we get data flows right in a way that ensures the highest levels of privacy and data protection are maintained and adhered to? How do we address issues together that we all know are important, like digital identity, like cybersecurity? Digital trade agreements allow you to do that. So I think the strategy and the approach in terms of how we move forward has got to be internationally focused. It's good for innovators. It's good for the UK. It brings new ideas, it brings new opportunities, brings new jobs, it brings productivity to the UK. And it's a way of increasing more, international collaboration, international partnership. Because these issues that we are facing, others will be facing as well, right? So how do we learn from each other? How do we share ideas? How do we work together to get this right, not just in the UK, but around the world? And I think also looking at the UK, how can we help in terms of what we're doing here particularly around data and some of the challenges that we know already face within the health and social care system, for example, interoperability of data quality, some of the really big meaty issues that Tim mentioned, the National Data Strategy, that is also looking at. How can we perhaps be a pioneer and leader in, using international standards that already exist that help encourage that interoperability, that safe sharing of data that can enable, and I think if we can play a pioneering role there, can help drive activities and international cooperation and an international approach by others. I think I've only touched on a few of the issues. There's a lot more to unpack there. There are lots of issues that perhaps we won't even get into today, Peter, but I think we have to look at the implications, and there's some really big meaty issues here. I agree, and I don't think we're going to solve them all today, but we need to keep talking. That's why I'm here. But also I think we need to think about the opportunities as well, and how do we get this right? And not just for industry, but for people and society as well. Thank you.
Thank you, Sue. Absolutely agree. And there's definitely things we'll come back to there in a couple of minutes. So Ruth, over to you now. Please do.
Thank you. So I'm going to talk about trade deals and how they interact with healthcare, and also try and talk a little bit about digital. I'm not an expert in digital, so I won't talk too long about that, and I'm going to rely on Sue to fill in the gaps. Where I want to start in terms of trade is just by really making it clear. Trade deals are not vehicles that are used to achieve human rights objectives, environmental objectives. That's not their purpose. Their purpose is very clearly to increase trade, therefore to liberalize trade, and it's driven by the agendas of companies lobbying their governments. That's what they're aimed at. And that doesn't mean that discussion of environment and climate and human rights doesn't happen around the margins, but if you look at a trade deal, the enforceable bits are the bits that increase trade. The unenforceable bits are the bits that refer to things like workers' rights, human rights, and the environment. So I just want to make that really clear from the outset. Trade deals are just about increasing trade. That's the whole purpose of them. And if you look at kind of why countries have signed up to that, it's partly because they believe fundamentally that if you increase trade, you get increased GDP, a rising tide lifts all boats, and kind of will solve all problems in that way. There's lots of evidence to show that's not the case. I won't go into that too much, but that's just is a kind of an underpinning debate. So the first thing I want to say in terms of trade and health is that, to be really clear, trade agreements do cover services, and depending on the country you look at, they're very likely to also cover your health services. And therefore, they can have profound impacts on healthcare and on the way that we design our services. Important public policy areas such as patents for medicines, medical qualification, workforce issues for health services are all covered by trade agreements. So they're really significant. When a trade negotiator is talking about services, they'll also include things like architecture, logistics, finances, things like that. And two important things that I wanted to flag that crop up in trade agreements, and you'll see this in basically all trade agreements, is that they cover any service in any sector except services supplied in the exercise of government authority. So when you'll hear the government saying quite often the NHS is not on the table, don't worry, they'll probably point to this phrase. But you then need to go back and look at what your country, in this case the UK, is doing in terms of services, because the trade agreements then go on to define what it means to be supplied in the exercise of government authority. And what's excluded from that definition are services that are performed either on a commercial basis or in competition with one or more economic operators. Now, I challenge you to find in the UK a health service that is not provided either on a commercial basis, right? Or you pay for your optician, you pay for your dentistry, or where there isn't also a private company providing the same service. I think we tried to come up with a list that I think we got as far as actually fire engines and maybe A&E, but it turns out that apparently ambulances are even provided by private companies in some cases. So it's really hard in the UK to find an example of a service that would be exempted unless the government deliberately chooses to. So just to give you a sense of the scope of impact that trade agreements have on UK health services because of the way our services are currently designed. Once you have that commitment in a trade deal, you're effectively locking in the level of privatization that you've already got, and you're also committing to maintaining levels of liberalization. So that means access for international companies to provide those services. You will be penalized if you try to renationalize or unpick any of the privatization that you've done to that date. There are other ways that trade deals impact on health beyond the services provisions. So, for example, you have provisions on intellectual property that impact on your ability to regulate the prices of medicines. There's a big debate happening at the WTO now where India and South Africa have requested a waiver for intellectual property provisions on COVID. The UK, alongside a number of other countries, is resisting that very strongly, and we are very concerned about this. Another way in which trade agreements can impact on health in general is through something called investment protection. So where a trade agreement includes this, it allows private foreign investors to challenge a government directly if they don't like a policy initiative and if the initiative can be shown to impact on their profits. So you have Philip Morris suing both Australia and Uruguay for introducing plain packaging on their cigarette packs. You have Slovenia being challenged by Achmea because they tried to withdraw parts of a privatized health insurance scheme, and Cargill suing Mexico for introducing a tax on high fructose corn syrup. So you can see that they have various different impacts on it, and they can reach very deeply into public health policy. So now we come to the digital side of things. Digital chapters in trade agreements are a relatively new innovation. You have both at the World Trade Organization a multilateral, so an agreement that involves many countries, e-commerce negotiation happening, and they keep telling us that this deal is coming. The latest deadline is the end of this year at the ministerial conference of the WTO. We'll see whether they get it over the line this time. They're also in deals like the UK-Japan deal, where the UK actually innovated on what had been in that deal when it was agreed by the EU. So it didn't innovate in any other area. Despite, for example, hosting COP26 this year, it didn't seek to make improvements in terms of provisions around the environment or climate. It did push much further on digital. So we see a much more wide-ranging digital chapter. We know that the big tech companies are heavily involved in lobbying for these chapters. And so the shape of the trade deal is influenced by their priorities. And what's really worrying about the speed at which these chapters are being developed is that it is far outpacing the debates that Alison has referred to, for example, on how we want to shape the digital space. So we know that the debates around privacy, around other human rights, around who benefits from the value generated by data that often comes from all of us as individuals, all of those debates are still really live. But the way that we regulate is being locked down in trade agreements where, as I mentioned at the beginning, the objective is simply to increase trade. So, for example, restrictions. So through these trade agreements, governments are handing over the ability to require the disclosure of algorithms and source code, the building blocks of many sort of healthcare, of healthcare equipment, of kind of databases and other things that are used in healthcare. They are also handing over the ability to require data to be stored and dealt with within their countries. And at the moment, there's a moratorium at the WTO on taxation, cross-border taxation of digital products. That's more of a problem for developing countries where their government revenues are more highly dependent on international and cross-border taxation. It's probably less of an issue for us in the UK, but nevertheless, what you're saying is that from the very outset, you're going to withdraw that ability to tax digital products, cross-border digital trade. So we think there are a number of issues We think that the trade agreements and the direction of travel at the moment risks locking in a model of deregulation before we've had the chance to really think about who owns this data that everyone's generating. How are we going to ensure equitable outcomes and equitable benefits from that data? I think the danger is really that because of the interactions between digital, health, and trade agreements trump all of that, sweep that aside, and we end up with a model that really just preferences increased trade and isn't clearly oriented towards public benefit. Thanks.
Thank you, Ruth, and thank you for that. I think between you, you've covered a huge amount of information and really set us up well for a good discussion now. So the way I'm going to run the Q&A is where questions come in, I'll try and slot those into the discussion. But then when a question is asked, it'll initially be directly to one of you. But then if you want to chip in or come in on the topic, please do let me know, because I want to get all of your perspectives on the various topics that we are covering, because it sounds like we have quite a good diversity of viewpoint here, so that's really good. So I'll open up with a question about large tech companies, because we've heard a little bit about this from each of you and your stances on it. So I'll probably start by asking Tim, what do you think are the most important things we need to consider when dealing with big tech companies in this space, and how do you think we can even approach getting it right when they have such clearly defined aims and can be quite aggressive in the space?
Well, Peter, thank you. I think the experience of the last year of procurement by government is not a good advertisement for government transparency or, in a sense, avoiding cronyism. So, in terms of PPE procurement, tech procurement, all the way round, we've got to clean up our act, basically. And so I would start in that procurement area. We have adopted certain guidelines in government in various sectors on the procurement front. But they're not enforced. There's no central compliance, and that's one of the real worries, basically. But then that all goes through to how we deal with the big tech companies in terms of data and in terms of how we deal with them. And I mentioned a couple of cases, Palantir, which we don't know really what they're doing with the health data. Of course, there are some things that need to be done. We have, a huge lack of interoperability in our health data in the health service. We could have a really powerful data set. And of course, we are beginning to make use of that in terms of spotting new variants, in terms of, basically tracking what is happening, within our health service. We're beginning to make progress on that. But, what worries me is that we give access to the big tech companies without so much as a by your leave, in a very non-transparent way. So that all needs opening up. And the other aspect is, I'm a big fan of the, if you like, the startup culture. And, you've got to allow them access to data sets. And, we now have the creation, and it's taken quite a long time to get it into place, of the digital markets unit within the Competition and Markets Authority. And actually, I do think certainly the way they've started looking at a number of aspects, but particularly consumers and so on, a number of aspects in the data and digital world, I'm actually reasonably optimistic that they are going to make something of an impact. But, as we've heard from all our speakers, this is a huge agenda. And, what worries me is you have to have political will to sort this out. And at the moment, the culture seems to be, we've got to share all this, and then, everything goes to hell in a handbasket. Even things that are mentioned, I think Ruth mentioned algorithms, in terms of if you have developed something in the UK, a trade agreement can make you disclose that if you're not careful. All this is not done on the basis of what is right for our citizens and our health service. It just seems to be to facilitate greater GDP, and that's what really worries me. But it is, as Ruth pointed out, the nature of trade agreements, and that's why the lack of proper mechanisms for scrutiny of trade agreements, which we have at the moment, is not satisfactory. And we've got to keep trying to get a better framework for all of this. And so events like this, where you bring people together, are extremely important.
Thank you. Would anyone else like to come in on that point of competition and maybe even, Sue?
Just to say, and I think it's really, and Tim made a really interesting, good point about the startup community as well. I think we need to be really clear here in terms of a lot of the examples that we talked about are about large multinational tech companies. But if you look, and they have an important role to play, of course. But I think we have to remember that the community, the digital community that services the health and social care market and industry in the UK as well as globally is vast, right? And it's made up of a lot of companies that are of different size, different sectors, will have different expertise in different areas. So yes, there are some really big players involved in this, but there's a long ecosystem, and I would say in the UK particularly a very vibrant ecosystem that is servicing this industry. So it's important to remember that. I just think it's important as we go through, we have to think about how we are supporting, enabling, as Tim said, those companies to be part of this community as well. And I think, some of the work that I know the Department for Health and Social Care and I think BASE is doing together on a Centre for Improving Data Collaboration, which we're looking to do some work with, how you enable that to happen. It's not just about one or a couple of companies, it's about how do we get this right for the whole ecosystem as well.
Definitely. And actually, Sue, I might ask a follow-up to you on the, so if we think of that ecosystem of startups, in this discussion, we focus very closely on data and artificial intelligence, but there's a huge number of different technologies that are very important in this space. And are there things in terms of the international trade discussion and business on a global scale that you think are really important to some of those other technologies that aren't necessarily about data?
Well, I can offer some perspectives, but then, as I think one of our speakers already mentioned, this all comes down to data, right? This all comes back to data. So essentially, it's issues of data interoperability, data governance, information governance, data quality, the ability for data to flow globally, because that's the world that we all now live in, is really, really important. But I think one of the issues as well to bear in mind is, we do see issues of international collaboration and partnership around how do we get this right in other areas. For example, cloud computing. There's a lot of work in Europe at the moment looking at how they can encourage greater use of cloud within a lot of member states that, we're very advanced in our use of cloud computing. There are a lot of countries out there that aren't. So how do you encourage that to happen? But in a way that the European approach to cloud is developing, it's very much yes, how do we do this to help support European member states? But how do we also enable that to be as open and competitive access to that market, to that development at the same time? That means that non-EU players, whether it's from the UK or the EU or Switzerland or wherever, can also contribute and can play in that market as well. So open access and competition has a real, I would say, important driver of innovation and driver of cooperation and partnership as well. But I think a common trend, and this comes back to data, is that one of the things we're seeing is it's a convergence of all these different technologies, right? There's no one technology that is really being looked at in whether you're in manufacturing, whether you're in financial services, whether you're in logistics, whether you're in shipping, or whether you're in health and social care. So it's all these technologies themselves. So organizations are looking at, okay, how can we develop our use of cloud, and how does it work with our Internet of Things? How does edge computing coming in this? If we were to use some AR, VR, how does that work? If we were to use blockchain, how does that work? Feels like bingo, digital bingo, but how, if we're going to use AI and data, how does this all fit together? And that's where that kind of global data flows becomes even more important. But how you do global data flows, and I think it's important also to remember, let's be really clear, that not all data is personal data, right? Yes, absolutely. Personal data is at the heart of health and social care, and it is protected, as we all know, more than any other data. And the data protection rules, GDPR, I think I'm right saying would trump any trade deal. It is protected. But not all data is personal data, right? There's a lot of other data that is flowing around the world. But how do you enable us to, or enable all of us to use and gain value and benefits from that data in a way that is still, privacy protected, is building trust and confidence around wider data use. So I hope that helps.
Yes, very much so. We're getting a fair few questions in the chat, but I think we might they're quite complex questions. So I'll try and weave some of the themes into our discussion a bit. But something that was touched on earlier that I think I'd really like to hear a bit more from Ruth about is that topic of international development, and where, say, nations that are developing technology, how can their trade and their approach to trade in this space be used more to help developing nations? Because we've seen a lot of difficulties recently with relation to things like the COVID vaccine rollout, but then there's definitely implications for this across the board, even in environment and climate and things like that as well. I'd love to hear your perspectives on that.
Sure. So I think the way that I look at the kind of digital world trade and developing countries at the moment is that there's quite a big risk, especially for the poorest developing countries, that they become almost in the way that they were when they were, and many of them still are, producers of sort of raw materials. So, if you're a cocoa producer or a coffee producer, you have for many decades been stuck exporting the raw material, which is the lowest value added in the supply chain. If you want to start to export chocolate bars or ground coffee or coffee products, you're often hit with significant tariffs. There are various parts of the trade world that make it very difficult for developing countries to move up the value chain and capture the gains from that sort of thing. And I think there's a risk of a similar thing happening in the digital world, and it's why we have some concerns around the e-commerce negotiations at the WTO. So at the moment, what you have is richer countries are the place where, and broadly speaking, is this is a kind of generalization, but richer countries are where a lot of the innovation is happening in the kind of tech and IT world. Okay, China and India might be exceptions to that, but so what you have are a lot of the innovations that are getting patented in richer countries, and then so that means there's already a kind of built-in bias in favor of richer countries. Developing countries don't necessarily have the resources to do that. And when you then transfer that into a negotiation at WTO level, what you have is effectively richer countries setting the agenda that suits them. So yeah, we might get an agreement on e-commerce. If it was a really good agreement, we might get something that works in terms of kind of human rights, labor rights, privacy, and so on. But what you don't get are negotiations happening about the issues that are of importance to developing countries. And that's not always around the same. Even if digital is a question, usually for a lot of developing countries, it's about being able to get the infrastructure in place in the first place, broadband speeds, the capacity to collect data in the first place, let alone the ability to then make use of that data. I think there's also a risk that developing countries, so in terms of the resource issue, what you could see in that case is that developing countries are not able to develop the technologies that they might need to treat the data, to use the data. So you might see a lot of data being exported out of countries richer countries, where they then develop products and sell them back to developing countries at premium, using the result, which is why we think this question of who has ownership over data, who captures the gains from that data, is really important. And it's really important that we do that before we kind of fix the rules of the game in the trade world. There are lots of other ways in which trade agreements impact on health in general outside of data. And so the TRIPS, the intellectual property protections for the COVID vaccine, are a huge issue at the moment. If the UK decides to have a trade negotiation with India, this will come up again. India is one of the biggest producers of generic medicines in the world, and when it was involved in trade negotiations with the EU wanted them to limit what they could do in terms of the production of generic medicines and to recognise longer patent terms. It will be a big argument if it comes to the UK. There were other bits of your question that I think I've missed, but we can come back to that.
That's really interesting, and it and that question of intellectual property, it's one that's also come up in the chat as well here. So and before Christmas, Alison, we were working on the intellectual property and artificial intelligence government consultation, which the responses to that have come out today. So anyone in the audience who's interested in that area, those consultation responses are really interesting to, particularly in this discussion. So I'd love to hear a bit more from you, Alison, about your views on intellectual property, and also, as a follow-up to that, some considerations for international trade and these developments of technology for the workforce in the UK.
Thanks, Peter. Yes, I did see the response, but I haven't read it yet. So another thing to look at sometime this week. First of all, I just want to make it clear that across the globe, if you look at all the leading governance bodies, the WTO, the United Nations, the OECD, the G7, I could go on listing a few other bodies, none of them agree about what systems or mechanisms you can use to have a universal set of standards in digitalization. So that's the problem you've got. You haven't got one body. In fact, the United Nations recently has just said it's going to set up a new tech body. Everybody's wondering how or why. Then, I don't know if people saw a few days ago, there was a push by 25 global and UK companies to set up a tech group inside the G7. What we're seeing is basically a pushback from what we will call corporate capture of data, because they don't want access to be democratized through mechanisms we've already got. The United Nations already has UNCTAD, which sets out guidelines of how you deal with digitalization. So has the OECD. It has a complete democratic space, if you like. The TUC have just literally spoken to OECD about some of the work we're doing, which we'll talk about in a minute, around a manifestation of digital rights for workers. So I think the problem we've got globally is before we get into trade deals, we haven't got a governance globally who agree. So if we look, Peter, when we were responding to intellectual property rights on algorithms, one of the things, if you want to get exceptions on how you can look into and break the trade secrecy or the IPR protection, is you have to pass a necessity test according to GATS. And it's really technical, long-term, it's burdensome to prove that it's necessary for you or your government to look into that algorithm. Nobody has created an international universal way you can audit an algorithm if you have an exception even agreed as a necessity. There are other things you can do with these exceptions. I do believe that Mexico and Canada and the US have written into their chapter on e-commerce that they want an exception where a government feels a regulatory body can request that IPR restrictions or trade secrets are exempted if it meets what is needed for a regulatory body. So we've got lots of regulatory bodies in the NHS. So what I'd like to see is the UK, global Britain, promote these exceptions in the public interest for regulatory purposes like medical devices. So there are mechanisms we can use, but they're not agreed. And it's up to every individual country in a free trade agreement to basically try and push what they want. And that's the problem. So the problem is we haven't got a universal set of governance bodies who agree on what we can do universally. And then it's all up to what we do in free trade agreements. The same problems that we're facing as consumers in the health service is exactly what workers also face. They face an increase in monitoring and surveillance in the workplace, which obviously leads to anxiety and stress. There's a blurring of home and work. We have situations where new technology is thrust on workers with no discussion. They also don't even know what they've consented to in the workplace in terms of what they've allowed their employer to do in the use of AI. That imbalance has to be addressed. Again, we see the EU is going to produce some guidelines on this. It's going to happen. There has to be some regulation. So I can't say too much, but watch out this week. The TUC, after a year's work, we've worked with all the trade unions in the UK to produce, we think it's the first manifesto for digital rights for workers. And actually, it could be as easily transferable to consumer rights, expansion of GDPR rights, and all sorts of things. And we have included trade deals and the fact that we don't want trade secrets or IPR to basically be used to weaken the right for workers to see what they're using or what's being used to determine their experience and career at work.
Oh, that was a fantastic answer to that quite long-winded question from me, so thank you. I've noticed we're swiftly running out of time, which this last hour has rocketed by. I feel that there's so much more that we could unpack here, and I would really love to in the future. Just to close, I'd love to hear from each of you which part of the world do you think is the greatest either opportunity or concern going forward for our trading partnerships and the implications for healthcare. So should we start with Tim?
Well, I think what worries me, Peter, more than anything else, is the whole issue of data adequacy, actually, in many ways, because it cuts both ways. And, you know, we may have it on a temporary basis at the moment, but we may not in the future if we start tinkering around with the GDPR or actually some of our existing national security laws are deemed non-conformist. And it's quite possible, now we're a third country, as far as the EU is concerned, that could happen. So I think that is the little cloud which may get bigger on the horizon, which worries me. The other thing which hasn't been mentioned today is the whole issue of data sovereignty. And you know, what worries me is we transfer public data, we use it in, we have it on servers which are not in the UK. We lose control over some of that data as a result of the action of governments, maybe legitimately under trade agreements, maybe not. But I do think we need to seriously think about cloud services. As you know, you and I have discussed that, and I do think that that's, you know, one of those areas that government hasn't really looked at properly.
Absolutely. Thank you, Tim. And Ruth, how are you? I'm just going in the order that you're now on my screen.
So with a bit of caveat of I'm not quite sure we're in a political place where this is going to bear fruit, but actually I think the UK is one of the places where there is the most possibility of something different happening and of the thinking happening that needs to bring the trade system into the 21st century. We've just left the EU. We've got to design our own trade policy. We are quite a big global player, right? We're a big economy, and we can have influence and clout. We can work with partners who we think are doing good things. And if the UK can start to put public interest, climate change, equitable outcomes at the heart of its trade agreements in a binding way, then I think that would be a really positive step.
Excellent. I definitely agree with that. And Sue?
Yeah, I'm going to steal that and perhaps touch on the UK as well as a real opportunity here. I think, well, obviously, digital is obviously it goes without saying is part of our lives more than it ever was before, and it will continue to do so. So having digital trade at the heart of trade agreements, I think is the right way to go, and it's important. But I think the UK has an opportunity here to be a pioneer in showing how you can do this well and how you can do this right. And data adequacy, I completely agree, Tim, is a really important tool that we can use, but also, of course, other we can use with other countries. But I think there's some really big issues here that the UK could really look at how it can, I always think of data protection GDPR as the floor, not the ceiling. How can we go above that? How can we be a pioneer in addressing some of these really big global issues and show the world and show the way in how you do this well for not just our economy, but our society and for people. And I completely agree, for workers and employees, and bring everybody along on this journey. And there's some really complex challenges and issues. And I think cooperation and partnership, because those, particularly on an international stage and international level, is vital and is key, because the challenges and the issues that we've all raised today are not the UK's alone, right? Every country is facing these issues and challenges. How can we be a leader in that way then? And how can we be a pioneer? And just finally, and to the point of auditing, we at Tech UK, we've just started that discussion around AI auditing and what that could mean in the future. These conversations are at a nascent beginning, but how can the UK really be a pioneer and a leader in showing how do you do this going forward? And I think that's the opportunity.
Excellent, thank you. And lastly, Alison.
Yes, I just want to say I'm not really sure, Peter, and I don't know if anyone else knows, what now the relationship is with the UK, with the United Nations, for example, given that we've obviously exited from Europe. And I think that's worth us looking at. And the reason why I say that is because the United Nations UNCTAD committee, which is their trade committee, has basically said there are 3 challenges that have to be dealt with globally. Climate change is the first one, inequality is the second one, and the third one is the digital economy. And I'm looking at that paper with some other people to see how we can input that paper and influence it from the UK to say, we love all those 3 things. How can we raise the standards then? The second thing I'll just say quickly, because I know time's up, is when we're looking in trade deals, if you think about the digital chapter, I'd call it a template. We have got an e-commerce template. So why don't we try and influence that template and bend it or create it inclusively, if you like, with civil society and workers, so that that template can be universally used everywhere to protect everybody's rights. But also, I do get the idea we can't stifle innovation or startups. Nobody wants to do that. We've just got to get the balance right. And that's what we want from a universal digital template, if you like.
Excellent, absolutely, and I think that that really sums it up very well. It's such a shame that we're out of time now, but thank you very much to all the speakers. In person, you'd be getting a big round of applause from the floor, but sadly, not today. So here's one from me. But yeah, I think it does look like we have a good opportunity going forward as the UK and global Britain. In having a really positive role in this space. So thank you all very much for your time today. It's been an excellent discussion. And for anyone who's put questions in the chat that we haven't been able to cover, I'll follow up with you where you've left your email. So thank you very much for doing that. And thank you all very much for attending. See you at our next event. Thank you.
Thank you. Goodbye, everybody.